Possible new intervention for Alzheimer's disease. Hello and good afternoon, Alzheimer's Association Grant Department. My name is Jennifer Delgado and I am a surgical physician assistant and researcher of neurosurgery. I have done research with Drexel University's College of Medicine in conjunction with treating patients with Alzheimer's and dementia at Princeton Brain and Spine Care for the last 6 years. We all know that exercise can help improve someone's overall health and memory. That's what they've taught us since grade school. Eat right, work out, and you'll be fine. But what about using exercise as a treatment to help with Alzheimer's patients? I've been doing research on the effect that exercise, specifically cardiovascular exercise and low-intensity weight training, has on patients with Alzheimer's and other cognitive impairments such as dementia. Alzheimer's, dementia, and mild cognitive impairments affect about 45 million people worldwide and nearly 6 million people right here at home in America. Treatments for these diseases typically involve medications and the person being put in a long-term care facility because advanced Alzheimer's and dementia patients require 24/7 care. Previous studies have shown that there is a relationship between cardiovascular exercise and weight training on memory. My team and I conducted a systematic research review of cardiovascular exercise and cognitive function being aspects such as memory or speech. The conclusion of the systematic review is that there is in fact a relationship between these two factors. Exercise can possibly help improve the overall cognitive function of patients with Alzheimer's disease. Of the 10 studies selected for the review, 8 out of 10 acknowledge this relationship, while the other 2 were concluded to have no significant difference. However, these studies did have limitations such as small sample size and a short intervention period. Although there is limited research and limitations done on the previous studies, based off the systematic review, there is evidence that further research needs to be done. My team and I want to conduct further research with a larger sample size and longer intervention period on how cardiovascular exercise and low-intensity weight training could affect cognitive function. If proven to be effective, this could supplement as a possible intervention to improve the most debilitating symptoms of Alzheimer's and dementia patients, memory loss and speech function. In our research study, we will be observing 2 groups, an experimental group and a control group. The experimental group will consist of at least 30 men and 30 women above the ages of 65 that will be put on an exercise regimen for the duration of the study. The control group will consist of at least 30 men and 30 women above the ages of 65 who will continue their normal care for the disease without intervention. We will perform a mini mental exam that tests memory, adaptability, speech, and many more cognitive abilities. The duration of the study will be 10 weeks in total, 1 week for observation and preparation, 8 weeks of intervention, and 1 week for conclusion and wrap-up of the study. We want to see if there is a correlation between the exercise and score on the mini mental exam between the 2 groups. We will compare the results of the 2 groups and see which group has the greatest number of increase on the mini mental exam at the conclusion of the study. However, in order to make this study possible, we need your help. We are requiring funds for the equipment that we will use for the exercise, as well as funding for the nurses, physicians, and physician assistants that will monitor the participants throughout the study. The Alzheimer's Association would be a great institution to sponsor this. Our research study of the effect of exercise and cognitive function could open the door to a different type of intervention to help with the debilitating symptoms that nearly 45 million people experience from Alzheimer's and dementia. My team and I thank you for allowing us the time to present our possible life-changing research proposal. And thank you for your consideration of funding our research.